House Bill 3637 does two things. It prevents disciplinary action from being taken on a healthcare provider who provides lawful care to patients in Illinois, regardless of whether or not the individual getting care is from the state. And number two, if the World Health Organization, or WHO, still recommends a drug, it can still be prescribed and dispensed in the scenario that the FDA revokes them.
Politics aside, that cannot be ignored, and I think it's foolish of us to enact bills that are it could be preempted by federal law. To depend on the World Health Organization, whose highest contributors and funding come from China, just seems very illogical to me.
The problem that I have with the bill is that this is setting precedents. This clearly has not happened anywhere else in the country, where we're asking the World Health Organization, which we're not sure if will be in existence in a year or could be considered political, to be able to supersede the FDA by which we look at as the standard for approving drugs.